Hello, and welcome to the ICU. You are probably experiencing some uncertainty related to your or your loved one's care, which is normal. But I'm here to help explain some of the things you will experience while you're here and try to make your time with us as pleasant as possible. The Intensive Care Unit, or ICU, is one of several units in the hospital that provides specialized care for seriously ill patients. An ICU is sometimes also called a critical care unit. Our ICU care team has experience treating patients with severe and life-threatening illnesses or injuries. It is difficult to predict exactly when a patient may be well enough to transition from intensive care, but the care team will determine when it is safe to leave the ICU. What needs to happen so I or my loved one can leave the ICU is a good question to ask your specific care team. Here in the ICU, we have many different team members that will be caring for you or your loved one. The ICU nurses and physicians are here 24 hours a day to help answer any questions you may have. The bedside nurse will introduce themselves daily and write their name on the board in the patient room each shift. Every morning, there will be a team reviewing the condition of all the patients in the ICU. We call this rounding. This team consists of physicians, pharmacists, advanced practice providers, nurses, and dietitians who all contribute to the care of our patients. You are likely to also see physical therapists, occupational therapists, respiratory therapists, speech therapists, and social workers who are also part of the healthcare team. You are encouraged to participate in these daily rounds. In addition to the bedside healthcare team, we utilize a remote monitoring center called EICU. The EICU is staffed by Barnes-Jewish critical care physicians and nurses who can communicate with patients, family, and the bedside team via two-way video and audio. This system is for monitoring only, and no recording is ever created. As you now know, there is a large team caring for you or your loved one, and there will be a lot of information shared. In order to make communication as easy as possible, we ask that you choose one person to be the main point of contact to help communicate with all family and friends. Often, patients in an ICU cannot communicate or make their own decisions. The person that makes decisions on behalf of a family member or friend is called a substitute or surrogate decision maker. If you or your family member has a legal document naming a person to make decisions, then that person is the surrogate who will be asked to help with any decisions. If there are no legal documents, the medical team will work with the patient and family to make decisions that are in a patient's best interest and consistent with their wishes. Making these decisions can be overwhelming, especially when there is uncertainty. We encourage you to discuss with other family members and friends to help. The healthcare team is here to help you understand any medical issues, explore treatment options, and give honest, accurate information about chances of survival and expected long-term quality of life. We will work to support a balance between a patient's wishes, beliefs, and values, and treatment options available. Due to the COVID-19 pandemic, there are changes to the visitor policy to meet the needs of our patients. Please check the Barnes-Jewish Hospital website, the information desk, or with your ICU nurse for the most current visitor policy. During change of shift, the team will be reporting the plan of care. Minimizing interruptions during this time is helpful. We may also ask any friends and family to step out for bedside procedures or assessments. We pledge to take exceptional care of our patients and families. We appreciate your help in creating a peaceful and calm environment and request that you refrain from any disruptive behavior while in the ICU. We have zero tolerance for any behavior that puts our patients, visitors, or staff at risk. If you have any concerns, please ask to talk to the charge nurse or manager. In emergency situations, first responders are taught to put their safety first. They can't help anyone if they are not safe. The same principle applies to patients in the ICU. In order to be the best caretaker and advocate, friends and family must also make themselves a priority. While we know it can be scary to step away from the bedside, we highly encourage finding time to get away, eat, and rest. Please ask the bedside nurse for locations of break areas. Our spiritual care department is available 24/7 and can help provide emotional guidance. 2 interfaith chapels are available on the medical campus should you wish to attend scheduled services or need a quiet place to reflect. Social workers can provide information on support groups, community resources, and assist with healthcare-related legal matters as needed. Illness or medication may have an impact on memory. Keeping a journal can help track milestones in care and aid in recovery. You can also use it to compile thoughts and questions and log events as they occur. Barnes Jewish provides internet access and printing services if needed. Showers are available on campus. Please see the concierge desk for access. Patients will leave the ICU when they have recovered to the point where they do not need intensive monitoring. They no longer require treatments that can only be given in an intensive care unit, and the care team feels it is safe to transition. After the ICU, patients will usually stay a few more days in the hospital before they can be discharged. This can be an unsettling time for ICU patients and families who are used to the constant attention they received in the intensive care unit. The nurses and other providers in the new unit want to know your questions and concerns. They count on patients to let them know immediately if they start feeling worse. A case manager or social worker will work closely with you and the medical team to ensure a safe transition from within the hospital to the right next environment, whether that is home, an acute rehabilitation facility, or a skilled nursing facility. Some people will not need any additional services and can simply follow up with their regular doctors in the office. Many patients, especially those who have been in the ICU for a long time, will require skilled help. You will participate in making the plan and will know what it is before you leave the hospital. Please let us know if you have any questions or concerns at any time. Thank you for watching this video. Hopefully you've learned more about what it's like being in the ICU. It is a lot to take in, so we don't expect you to remember everything you've seen in this video. You're going to have questions, and we encourage you to ask when you don't understand what's happening or if you have concerns.